Hello, and welcome to Talking Adoption. And today we are looking at ways to prepare. I'm Grace Gomez, and I am the Adopter Diversity Recruitment Officer, and I work for PACT Charity in the Reading office. I'm joined today by Daryl, who is our Senior Enquiries Officer. Welcome, Daryl.
Thank you for having me.
So, first of all, can you briefly explain the process of adoption and the timelines, please?
Well, the adoption approval process takes normally 6 months to complete. That 6 months is broken up into two stages, stage one and stage two. Stage one is a 2-month process where a number of checks are carried out. So we need to undertake DBS checks or police checks for our applicants. We need to obtain references for each of our applicants. Each applicant will need to provide 3 referees. We need our applicants to undertake an adoption medical through their GP. And also we need our applicants to attend our 4-day preparation training course. Once stage one is complete, our applicants will move into stage two, which is a 4-month process where we allocate a member of our social work team to a family to conduct a home study or a home assessment and assess their suitability to adopt. Once the assessment is complete, our families will attend our adoption panel or approval panel. All being well, they'll be approved as a PACT family. So that process, again, will take 6 months to complete, and then we commence family finding for our families. This process has, in terms of timelines, has lengthened over the last 2 years. We're now working in quite a competitive adoption climate where we have a significant number of families waiting, not only at PACT, but across the country, but also less children waiting to be placed for adoption.
So going back to the process and the things that you've mentioned, how would all that fit in with people's existing work commitments?
Again, I would encourage families to begin conversations if they feel comfortable in doing that with their employers. Some families would choose to wait till they know that they're actually starting the process and in the stage one before having those conversations. But I think it would be invaluable for them to start having those conversations when they're in stage one with their employers and just having conversations around the time that they could potentially take off to attend our preparation training, for example, in stage one. And then as they get closer to having a child or children matched and placed with them, being available for introductions, which introductions should generally take between 1 week and 2 weeks to complete.
And what are the statutory requirements for adoption?
The two main statutory requirements to adopt are that applicants need to be over age 21 and over in order to adopt. There is no upper age to adopt. And also applicants need to be legally resident in the UK. And also be in a position to evidence that they plan to build a life in the UK and remain in the UK for the foreseeable future. Those are the two main statutory requirements in order to adopt.
So what can people who are considering adoption do to prepare themselves?
One of the main things they can do is undertake voluntary work to strengthen their childcare experience. If a family feels that this is an area, or prospective applicants feels this is an area where they could strengthen, then we would very much encourage them to do that. We are working in the climate now where the local authorities that we work with are looking for that in our families. So undertaking voluntary work, contacting nurseries, charities that work with children with additional needs or a range of needs would be suitable, and continuing that voluntary work leading up to starting the process and then throughout the process. We also would like them to develop that childcare experience by engaging with children that are connected to them, so nephew, nieces, godchildren, their friends' children, having sole care of those children, overnight care of those children. So there are really two ways that we are looking for our families to strengthen their childcare experience: through volunteering and working with children that are unconnected to them, and also having sole care of children that are connected to them. I would also ask families to give consideration to their homes, so ensuring that they have at least one spare bedroom available for a child. If a family is considering adopting a sibling pair or a larger sibling group, which we're encouraging families to do if they're able to do so, They would have to have at least one spare bedroom available for each child, ideally. If there are significant life events or plans that families have, we would ask them to complete those plans prior to starting the process. So if there is a home renovation or a house move or a career change, we would definitely ask families to complete that prior to starting the adoption process. Also giving consideration to if they have children a part of the family already, then building and having conversations with those children and preparing those children already part of the family for the potential of another child or children joining them.
What are the medical considerations for prospective adopters?
As I mentioned, in stage 1, there is an adoption medical carried out through your GP. We would suggest that all of your medical records are with your currently registered GP. So if, for example, you've moved recently to a new area and you're transferring your medical records from your old GP to your new, we would encourage that transfer to be complete before starting the process, because we will carry out an adoption medical with your registered GP in stage 1. If you have any health conditions that you're working through, or any planned operations or anything of that nature, we would ask for those to take place and you to make a full recovery prior to starting the process. If you have experienced any issues around with regards to your mental well-being, we would ask you to ensure that you're in a stable place and a good place in order to start the adoption process. If you're recently been prescribed medication, for example, we would ask for a period of being on that medication and settled on that medication to have take place. We do have policies in relation to BMIs, so in relation to prospective applicants' weight. So we do have guidance around applicants with BMIs between 35 and 40 and over 40. And we will seek medical advice from our medical advisor in stage 1 around that, and have some further conversations with prospective applicants around ways that they can potentially reduce their BMIs if that's possible. We also have policies around smoking. We need applicants to quit smoking 6 months prior to starting the process and be smoke-free for a year by the time they get to our approval panel. And also policies around vaping. Any prospective applicants that are vaping, they will need to stop vaping immediately and be 6 months vape-free by the time they attend our adoption panel.
So can you suggest any reading resources or podcasts or any good websites that people can do further research on?
Well, I would definitely encourage families to continue their reading and research in preparation to adopt and throughout the adoption process. That is going to be invaluable. In terms of reading, I would suggest that they refer to our website, pactcharity.org. Also, the First for Adoption website, which is a great e-learning module on there, which helps families build their readiness to adopt. We work with 2 partners, New Family Social, who work with LGBTQ plus families who are adopters and foster carers, and we would encourage some of our prospective applicants to look at that website. And also, we also work with Home for Good, who are a faith-based charity, and we would ask families to also look at that website if they felt they would like to do so. There is an invaluable podcast on the BBC website, I believe it's on BBC Sounds, and called The Adoption, and it explores across a number of sessions the process, a family's journey through adoption and the impact that has on the adoptive parents and also birth family.
That's great. Thank you, Daryl. Fantastic. Lots of really good information. So we'll put a link to all of those websites below. And as Daryl said, there's lots more information on our website, pactcharity.org. Thank you.
Thank you.